Whenever you're ready. All right, I want to welcome everybody. This is the Kentucky Dental Association's legislative key contract training. Tonight, we're just going to go over some of the tidbits to help you have a little information in your pocket about what's going on right now with the KDA and what we have planned for the upcoming legislative session, and some advice on how to communicate with your legislator, how to schedule a meeting. So we're hoping that you'll be a lot more comfortable with it once we get through this tonight. And as we mentioned earlier, when we get to the end, we will have a segment for all of your questions. So I am Dr. Steve Robertson. I'm the Executive Director of the Kentucky Dental Association. With me tonight is Miss Libby Milligan of McCarthy. She is our contract lobbyist. Sorry for stumbling over my words. That's another famous quote for work wife. Uh, so Libby is my right hand everything. Um, Tonight we're going to work through this with you, and we've got some information that you did receive in your invitation. We're going to go over that at the end also. We've got a few slides explaining what those different packets are, but most of what you're going to see here tonight is also referenced in those packets. So you will have something that you can go back and look at. So Lib, you want to take off?
Hi. So this is the training overview. This is what we're going to cover tonight. And to reiterate what Steve said, this is more detailed information is in those training packets that you received in the email. So and in greater detail. So don't, this is going to be a lot of information, but don't feel overwhelmed because you can always go back and reference the material. But we're just going to do a high level explanation of what is KDA Advocacy 101. We're going to talk about KDA legislative contacts. We're going to cover the 2026 regular legislative session and issues of interest for 2026 session, and then next steps. At the end, we're going to wrap it up and kind of figure out next steps for you all and how you can take this information to go advocate for the KDA. So Advocacy 101, and I'm not going to read through this, but really high level, folks say, how do you advocate? How do you talk to legislators? The key is an effective message and keeping it simple and clear for the legislators, and also a unified message. And I'm going to pick on Dr. Howard, Dr. Shelton, that, if Dr. Howard was saying one thing and Dr. Shelton was saying another thing, and they went to the same person, they're like, oh my gosh, who do I trust? They're saying two different things. But if they went saying the same message, then they're like, oh, I trust these people. So that's the idea of that simple and clear message for the Kentucky Dental Association. The other thing is to build relationships with these elected officials. And I know that it can be daunting. And for the students out there, remember these are elected officials. They're humans. They have day jobs. Some of them are teachers. Some aren't even in healthcare. We have farmers in the General Assembly, attorneys. So the best piece of advice when you meet with legislators, treat them like your patients, like they're in the chair and you are educating them. And it brings, it puts everybody at ease. The other thing is to understand the legislative process when you're going in. So if, for instance, you're talking to a legislator, to have those talking points together to know, am I talking about a regulation or am I talking about a bill, a piece of legislation? So that's very important. And also engaging in the political process through the KD PAC. And Darren Greenwell, Dr. Greenwell is not on this evening, but that piece is key, and I'd recommend folks to reach out to him at a later date to get engaged with the KD PAC. And I mentioned, I pointed out this slide, it is in your training packet, but this is a great little pocket guide to how a bill becomes a law that the Legislative Research Commission put out. So it visualizes the process. So if you were to get an alert from Steve and Steve's like, Dr. Howard, I need you to contact, Senator Storm and talk about this bill that's going to be in his committee. This kind of depicts where things are in the process. And on the right side, there is a great glossary of terms. So if you have a question, it's a great reference. If you get an alert from the KDA, or even if you read something in the newspaper and you're like, well, what does that mean? An amendment. It's all on here. For the relationship building part of it, just want to stress at a really high level that the legislators have day jobs. So we have a part-time legislature, but especially during the legislative session, they're diluted with all kinds of information from constituents. They may get hundreds of emails a day and telephone calls. So it's really important, especially during session, to be very clear and concise with the messaging, and not being adversarial with them if they don't agree with you, because sometimes that happens. But a great tip is to educate them about the positive and negatives about the issue that you're wanting to speak to them about, and the positives and the negatives, but be accurate and provide correct information. So that's where the KDA talking points come in to the process, because the worst thing you could do is get a question from a legislator and pick, something out of the air. And the first instinct is, ooh, I want to answer their question. Don't feel pressured to if you don't know the answer, because you can simply tell them, I don't have the accurate information at my fingertips at this moment. Let me follow up with you. Or, if you don't feel comfortable, you can call Steve at the KDA and say, I talked to Representative so-and-so, and they asked me this question and I didn't know the answer. Could you help me answer it? Also, if you're talking to them, don't be scared to seek a commitment from them, whether it's supporting something, a particular piece of legislation or issue, or opposing it. But don't pressure them. Sometimes they may say, and it's not uncommon, especially if a legislator is not familiar with healthcare, as there's some legislators that don't sit on health committees. So if they're like, let me take a look at it, don't feel pressure or defeated, because it's a great opportunity for you to say, why don't you take a look at the information and I'll follow up with you in a couple weeks, and exchange email addresses and cell phone numbers. And at the conclusion of the meeting, always send them a thank you note. Legislators, 9 times out of 10, they don't get a thank you. A lot of them are everybody's complaining about something. But those are just some high level tips. Again, refer to the training packet. There's sample scripts and all kinds of stuff in there. So we're going to transition. That's kind of the high level of the messaging and advocacy. And we're going to transition over to the key contact program, and I'm going to kick it over to Steve.
Yeah, I'm going to add a little bit on to what Libby was talking about, because really the best thing to remember here is this is like having a conversation with your patient. Remember, when you're talking to the legislators, that they don't understand the words you're using that you would use to talk to another dentist or to one of your employees. You all probably talk about in your own offices or even in school that you have to bring it down to a level that they're going to understand. You can't talk about an MODBQ on tooth number 412 and we're going to come in from the unilateral upside over that you're just, and it's gone. So, you have to break it down and talk to them and realize that these are normal people. These are just regular people, just like the people that sit in your chair. And some of the people on this call may actually have patients who are legislators, and they'll tell you they're real people. And what you're trying to do is establish that there's not a lot of pressure in this. You're establishing yourself as their local expert. I mean, you're the person you want them to feel like if they have a question about dentistry that they can reach out to you. And if you ever feel like you're stuck, always look at them and tell them, that I'd be more than happy to put you in touch with Dr. Robertson or Libby because chances are they're going to know who we are anyway. And, we're there for you. We're there to help you through this. But my story that I give everybody is that in 2022, we passed a pretty sweeping insurance reform bill. Uh, at that point in time, I was not in this position. I was a practicing dentist in Bowling Green, Kentucky, and I didn't have time to drive back and forth to Frankfurt at that point in my life. But I knew all the local legislators, the senators and the representatives, and I was in contact with every one of them about what was going on with the KDA. The day the bill came up for vote, I got 16 phone calls from legislators and staff members clarifying things and asking questions. That's what you're looking for. You want to be that person that they're comfortable reaching out to so that, you're sort of there. Oh, this is about dentistry. I've got to call Dr. Howard. I've got to call Dr. Harper. You've got, that's what you're hoping to do here. So, and that makes you their key contact. Once they're comfortable talking with you, you've established that relationship that they feel like they can rely on you. And the reason that it's important, I already brought up the fact that they've probably met me, they've probably met Libby, they've absolutely met Libby, they've probably met me, they know Libby. And you can always refer to us, but many, many, many times those legislators will talk to us and then they'll want to turn around and talk to somebody in their district, somebody in their hometown, and find out what the opinion is back home. That's what they want to know. And that's the position that we're trying to encourage you folks to fill so that we can have these contacts with these people. Because once you establish that, you'll be sitting at home one night, one afternoon, and you'll get a text from your legislator. Hey, what do you think about this? And that, that you're their expert. And when you establish this relationship, one of the primary things here is we really want you to let us know, like, hey, I met with Representative Jones. I met with Senator Stivers. We had a great conversation. They said this. Another one of the things that Libby said is that understand not every legislator is going to agree with your issue. And if that's the case, don't push it. Just move on because politics are very strange. When we get to the end tonight, we're going to talk about several issues that we've got on the table right now. Our primary motivation in doing all this at this point in time is Medicaid, but there are other issues on the table. And you're going to find out that there are a lot of people that might be supporting us on one issue, not necessarily supporting us on another. So we're going to talk about that in a bit. So don't ever cut your nose off because you might have to come back the next day and have a very different conversation with them about something different. If you find out that maybe they're not sure or they don't agree with what you're saying, that's when you want to reach out to Libby and I and make sure that we're aware.
And also, if they don't necessarily agree with you, um, I'm meeting with legislators all the time and elected officials, asking for their support, or whatever the issue is. I always leave it open-ended with them that, sometimes they get really passionate and you're just like, you'll just say, simply, I understand, I respect where you're at. I ask, just keep an open mind. Let me leave this information and just take a look at it, and if you have any questions, get back to me. And it leaves the door open. So you didn't burn a bridge with anybody, but you kept the dialogue going on the issue.
And
Um,
ask them if they'd like for Libby and Steve to circle back with them.
and
Uh,
I've done that before too, that some legislators have been on the fence meeting with their key contact. And the key contacts like, do you mind swinging by their office? Or Steve will call and be like, hey, do you mind going by so and so's office? And I'm happy to do that and just sit down and have a one-on-one as a follow-up with them. Um, I mean, this really is, it's a key contact program, but it is a team effort. I'm going to pick on Jenna, but like if Jenna called her local representative or senator, and they said one thing to her and she's like, hey, Libby, I met with them and, they were kind of wishy-washy. I can go in there if I see them in the halls in Frankfurt during session and say, hey, I heard you met with Jenna and, what did you think about the issue? So, I mean, it really is a team effort there. And if they say no to something, don't feel defeated because you can say, hey, we can work together on other issues. So that's my TED Talk.
All right.
So do you want to explain the key contact program?
Well, yeah, really. I mean, we kind of have. What we're trying
Okay.
to do is establish that contact within their local district. So our goal, that's probably going to be come up on another slide here in a bit, is that our goal is to have every legislator in the state of Kentucky contacted by a dentist within their district by November the 15th. And I know that sounds remarkably specific, but that's just trying to avoid the holiday period. Because once you get into Thanksgiving and past that, everybody's schedule gets nuts. Yours, the legislators, everybody. And it's just kind of harder to find that time because what we're going to encourage you to do is to reach out to these individuals and invite them to your practice, invite them to meet you for a cup of coffee, invite to take them to lunch. It's always great to have them come to your office because you get them to come meet you on your turf, see what you do, see your office, talk about how things work, talk about how, you're serving the community, you're employing people within your community, you're supporting your community, just kind of show them and show them around, introduce them to your employees, let them meet people, talk about some of the challenges of being a dentist. We're going to talk about that a little later on. Since specifically what we're after here is Medicaid, tell them your issues with Medicaid. Tell them if you're not a Medicaid provider, tell them why. Tell them you can't afford to be.
Mhm.
You can't afford to work at a loss because you're running a small business. That's a very fair comment.
And your personal
Tell,
story.
yeah, use your personal stories. And you're going to find that as we get to the paperwork later that was included in your invite, there's a lot of talking points in there that you can use. There's not, the only thing that there's a script for is a phone call or a email to schedule the visit to get together with them. Because outside of that, we would rather you take the talking points and use your own words to put it together. The message will be the same, but it will be yours. And
Yes.
that's really what we're after because that's what we're going to remember.
Um, so all this to say, you're like, okay, Steve, great. I want to be a key contact. You we have information that's in the packet, but I wanted to put this up there to kind of give you a quick overview. If you go to the Legislative Research Commission's website, they have a page that's Find My Legislator, and the link's in the packet. All you got to do, it's really easy. You click on the link and you can type in where, your practice address. That's something good to find out. You can type in your home address because that will be you are that actual constituent. And it'll pop up and the screen will pop up with your state representative and state senator. And it'll have a link to their email address, their office address, and their phone number. And the process on if you want to send an email to them, that's in the packet. We also have provided you with a sample call script on to schedule the meeting. The best thing to do is when you call their offices, they each have an assistant. And that's one of the easiest ways to get on their schedule. And those assistants are great. They're like your front office staff. So, you know, you know, I say attitude's gratitude. Express a lot of gratitude and thanks with them because they move heaven and earth for the members
And
that
then
they take
sometimes
care of.
those assistants are the ones that will push them back to you when something comes up that they're looking for
Yeah.
information on
And
because they'll remember you also.
so I'm going to run through this at a high level, but this is all again all in the packet. Um, Scheduling a steps for a meeting. In person is preferable. If you got to do it by phone during, because of their schedules, I always leave that open with the assistants or even a Zoom. If you are a constituent, let them know up front because they will always want to meet with their constituents first. Um, the other thing for scheduling a meeting is since session starts in January and they're only there for 60 days this year, you can imagine everybody in their district trying to get in to see them. So that's why it's important to try to meet with them before session. So if they do see you during session, they've already, associated with you. And again, what Steve said, coffee, invite them out to your office. Sometimes I know, I forget who it was that they ran into their legislator at Kroger grocery shopping, and they just had a whole conversation there. So, schedule the meeting when you're preparing for the meeting, do your homework. These are things, when you go to their website, you can research what committees they serve on. It'll have their general interests on there, where they went to school, their profession. So those are great things for you, to break the ice with them. Also, when you're preparing, notify Steve of the meeting ahead of time, and he can provide you talking points. If it's not an issue where you don't already have the most updated ones, but also if there's a certain legislator that he's met with, or I've met with, we can kind of give you additional background on them. And the day that you meet, again, accurate, clear, and simple. Stay on message. We want everybody singing from the same hymnal. Um, we don't want to be a dysfunctional band where everybody's playing a different song sheet. And post meeting, report back to Steve, to let him know how it goes. And make sure to send a thank you letter. I'm going to go back to meeting outside of session. I'll just say it's a great tip because legislators have more time to spend with you outside of session. So go ahead and work on building that relationship now. It's really hard when you need to talk to a legislator about an issue, and the only time that they hear from you is when you're complaining about something or whatnot. So outside of session is a great time to build the relationship, but keep it going. Of course, if you got an issue with the bill and whatnot, you're going to email them or call them during session. But outside of session, touch base with them. Go have coffee and just ask them, hey, what are you working on? How did session go? Did I miss anything on the meeting tips, Steve? Those
Well,
were the high points.
once you've had a chance to establish contact with them and you've met with them, one of the reasons that you want to let us know is that when we get in Frankfurt, we're going to reinforce that. We'll be able to go in and sit down in their office when we're meeting with them and say, oh, I heard that you had a great meeting with Dustin, or, that you were able to meet with Dr. Johnson or whoever. And they always are like, oh, yeah, that was awesome. I got to go out to their office. They're excited to do that. Remember, every representative, because they're elected every 2 years, they are always running for office. So the representatives will always want to come meet with you. The senators usually will be more than willing to come meet with you. Half the senators are up for re-election next year, and the entire House of Representatives is up for election next year. So, they're always campaigning. So when you mention you're a constituent, that equals, hey, I vote. They're going to come see you. So don't feel like you're putting them out. They want to come see you.
And a lot of them, I'm not going to say who it was, but there was a recent meeting with a pediodontist, and that pediodontist did a great job educating their senator, and they knew nothing. And the senator left and actually bragged to our firm about the meeting and how informational it was. So, you know, don't be worried necessarily about the issue because they're learning things too when you invite them out to your practice. And I saw Jenna smiling real big, and it wasn't Jenna, by the way. I'm going to move to the next slide. So we're going to transition. So that's kind of the advocacy piece. I know we ran through that. You all have those packets. So, save them on your computer as a quick reference. As I mentioned, there is a call script, a letter script, an email script in there. Personalize it. any way you need. But and also you can use it for the assistants as well in the legislative offices. But we're going to transition to the 2026 regular session. I'm going to provide a quick overview, and then Steve's going to dive in on the issues that the association's working on. So the 2026 session is a 60-day session, and what we call in Frankfurt a long session. Since it is an even numbered year, this is a budget session. Kentucky is on a biannual budget, so they will be working on the state budget, and Medicaid is included in that. Session starts January 6th, and it runs till April. In your packets, there is a link to the legislative calendar. This slide is not updated, but a couple of days ago, the legislature updated their session calendar, so the link in in your packet should work. The committee process and these are general committees that a lot of our issues in dentistry go to, but obviously leadership in both the Senate and the House, they run interchange, if you will, on bills that get to the floor for a full vote in each chamber. So those relationships that we have are very important there. The House and Senate Banking and Insurance Committee. So those are your insurance issues, mainly commercial market issues. House and Senate Appropriations and Revenue. This is the Budget Committee. This is the Money Committee. Medicaid budget, the whole thing, including Board of Dentistry. Which they don't sweep those funds anymore, but all of the state budget goes through there. Another committee that our issues go before is the House and Senate Health Services Committee. So those are general Medicaid issues, and overall healthcare issues. Last year, the fluoride bill went to that committee. We have one-off committees that are not on here, but like licensing and occupations, that committee deals with professional licensing issues. And then also there's a newly formed committee. It is not a legislative standing committee during session, but it's called the Medicaid Oversight and Advisory Board. And it was created last year, and it is a board to really take a deep dive on Medicaid issues and changes to the Medicaid program. So if you meet with a legislator, you may hear about, they may bring that up. So that's it's a board, but it's comprised of a lot of legislators. We have a non-voting member that is a dentist on there, so that's a good thing for us. Long term, but those are the committees that you'll hear about a lot with our specific issues. And save the date here, February 4th is the KDA Legislative Day in Frankfurt. Details will follow on that, but we went ahead and locked in a date. So be on the lookout. There will be an email, but save the day, February 4th.
Trying to give you time to get booked out so you can get there because it is during the work week, but our work week is their work week. So hopefully we'll be able to get a lot of people there for the push, and be sure and say all your tooth prayers so that we can keep the snow out of Frankfurt and everywhere else so we can get there on February the 4th, because last year we got snowed out and didn't get to have a legislative day. So some of the items that are on the table this year, we've already mentioned that sort of our A1A priority is Medicaid. We have been working on Medicaid for, I don't know, let's see. I graduated from dental school in 1992. We were working on Medicaid then, and we were probably working on Medicaid from whenever the program started before I graduated from dental school. So we've been fighting Medicaid forever. Some of the
its
stuff
variations.
in its multiple variations. Just to throw some stuff on the table that is in your packet, for those of you that haven't heard this in other places, the base Medicaid rate in the state of Kentucky was set in 1997 at 75% of the 1987 UCR. A lot of you on this call probably weren't born in 1987. That is still the base rate of the Medicaid program. So when we tell you that dentists are getting reimbursed at about 25 cents on the dollar, that is pretty accurate. Um, there's a lot of movement that's needed here. There's a lot of things that are in that talking point sheet. Dentists are really one of the few segments of Medicaid that are asked to work at an absolute loss. And to put that in perspective, one of the things that we present is that a one surface filling in Medicaid is reimbursed at $44. The supplies necessary, just the supplies, not your team, your equipment, your insurance, your overhead, any utilities, paying yourself, anything, just the supplies are $89 that you're getting paid 44. So keep in mind when we talk about we need big changes, if we double the program and theoretically double that payment to 88, you're still losing $1 on supplies. That's how far behind the dental program is. Now, the significance of that is that the vast majority of the legislators are very aware of this. They have heard this. This has been on the top of our sheet for Libby and I since I took this position about 3 years ago. So for 3 years, we have really been working and working and working Medicaid. They're aware of the story. They're aware of the pitfalls of the program. They're aware of the situation of the dentists in this program. They're aware that we're losing all of our rural providers, for lots of reasons. And also that we've now reached the point that our Medicaid rates are affecting the ability of people to make the choice to practice in the state of Kentucky, which is why we're glad to see a lot of the students on here because we need you to share that message. We actually had a student 2 years ago at Lobby Day, when a senator was talking to them about different things they were considering doing, they brought up the concept of a provider tax to fund the Medicaid program. And they had just talked to all the students about where they wanted to practice. They looked at one of the students and said, what do you think about that? And his comment immediately was, I think I won't be practicing in Kentucky. And that reverberated around Frankfurt for weeks. I mean, it became one of those mythical comments, a true mic drop moment, because it just it especially made it hit home specifically for that senator that here you had somebody that was training at a state dental school that just looked at you and said, yeah, if you do something like that, I'm not staying here. Why would I? And that was the big take home message. So that's why the students are so important in this message because you have a very different viewpoint. You've got a lot of decisions that you've got to make about where you're going to practice. And right now, improving this Medicaid program is one of the things that ultimately can make it easier for all of you to stay in our state because this is the first step towards bringing up the overall reimbursement levels in our state. Because the last message I want to make sure that everybody has about Medicaid is that those Medicaid rates are used by the private insurers in their actuarial process to set their reimbursement levels. That's why Kentucky's reimbursements are so low. Basically, they're saying if you're willing to work for this, because this is what the Medicaid program pays, then we're going to reimburse this. And that's why if you talk to some of the dentists that work along the borders of the state, they can all tell you stories of how there are patients that travel across that state line and that dentist gets almost 50% more than we get in Kentucky for those procedures and sometimes more. And this is what's at the root of it. So this is what we're attacking. The other primary thing that's going on with Medicaid right now is we're really looking through the MOAB that Libby mentioned at revamping the program, kind of the delivery system of Medicaid. There's a lot of interest currently among the legislators to look for alternative management methods, possibly moving away from the MCOs. So we could be in a situation where we're going to be looking at something like a carve out where they separate us from the MCO program, sort of as a test for how they can make this work with other smaller groups like dentistry. And this is pretty important because we're big fans of this idea because it's going to give us an ability to kind of redraw some of the lines and reestablish some of the guidelines of what's involved in participating in this program. So you may hear some of the legislators talk about a carve out. There's a information sheet in your packet about what is a carve out to give you some basic information. And if you feel like you have a few more questions, feel free to pick up the phone and call me anytime. And I'd be happy to talk with you a little more about it. Other things that are on our list, the non-covered services cleanup. This will be go round number 4 for the KDA on non-covered services. We've been working at non-covered services since 2012 or 11. I can't remember. It was either 11, 12, 17, 2022, and now 2026. And hopefully this time we've finally driven the final nail in the coffin. We've taken the time and we've sat down with the Department of Insurance to really go over what are the hiccups, what are the issues, what's holding this up, and we feel like we have them identified. So we're going to go back with this cleanup, which should get the non-covered services stuff straightened up. And then hopefully we will reach the point, because what we've been after the entire time and what the legislators believe they have passed 3 times previously is that over the maximum is a non-covered service, and an insurer cannot tell you what to charge if they are not paying you for your services. It's fair. They've obviously voted for it 3 times. We aren't anticipating a lot of issues getting this through, but you just never know. It's Kentucky politics. The fluoride bill. I wish we were talking about a fluoride bill that we were in favor of, that we're like, heck yeah, we want fluoride. But that's not what this is. The fluoride bill dropped today. So if this is being recorded, it got posted today. So today is the 14th of October, and it got posted that is going to be presented in the interim committee on the Committee for State Government.
And I want to jump in and clarify, it has not been filed. They're
Yeah,
having a
yeah.
discussion of last year's bill that was filed from 2025, just for clarification.
Okay, thank you, Liv. I will tell you that we are obviously opposed to removing fluoride from the water. Kentucky is one of the most heavily fluoridated states in the nation. We're well over 95%. There's a lot of projections on issues here. This will be the 8th year this bill has been filed. We've managed to win to this point. It keeps getting more and more difficult. Last year, it did pass the House for the first time. And for a lot of different reasons, it did not receive a committee hearing in the Senate. There will be a companion bill introduced in the Senate this year, we are being told. So they're going to attack it from both sides. We're going to have a lot to work on with the fluoride bill. And this is really the issue that Libby and I were referring to when we said there are going to be legislators that don't agree with you on everything.
Yeah.
We have some folks who are staunchly in favor of what we're calling the anti-fluoridation bill, and they are staunchly in favor of Medicaid relief for the dentists.
And they're in favor of Medicaid relief, but then some of those legislators that voted for, as Steve refers to, the anti-fluoride bill, they voted for the assignment of benefits bill, and some of them signed on as co-sponsors to it.
Yeah.
So that
remember when we talk about in our dental circles, we refer to it as an anti-fluoride bill. It is presented, promoted as a local choice bill. Really what they're promoting is for the local water districts to have the individual choice of whether or not they're going to fluoridate the water. But that's really depending on the bill that gets filed and the wording of that bill. That has actually been one of the major fights that we've had, is who makes that local choice.
And then we got the number 4, other issues. We have issues all the time during a legislative session that pop up out of nowhere, or sometimes it's somebody else's bill and we end up getting dragged into the conversation, as I like to refer to it. I'll let Steve go over it. Now, those issues, these are the priorities, so to speak, what we're working on. But as those pop up, just to alert you, Steve may send you all, if you sign up to be a key contact, he may send out an action alert and be like, hey, this, this was filed by so and so. Do you mind calling your legislator, your senator and representative, and talking to them about it? So I'll let you go through maybe a few potentials or examples.
Yeah. First, where Libby was talking about the reaching out to folks, we send out the email blast, but I would really encourage all of you to look in one of the journals for the QR code to sign up for the text alert program. Because we're not going to send you 4-page text, but you might get a text that says, "Hey, we just sent you a really important email," and then you know to go look for it. It might say legislative alert, and you'll know that there's something that you need to check out. But most of us are a little more attuned to our phone than our actual pile of email that comes through. So, other potential issues, it's there are a lot of well-intentioned people out there in the world that think that they have all the answers on how to fix the issues in Kentucky. And, we have to understand that we do have serious access issues in the state of Kentucky. We're losing a lot of our rural practitioners. We're having serious hygiene shortages, assistant shortages. We're having workforce issues. So we could see bills come from all kinds of different arenas that could be about different workforce issues. They could be about expanding somebody's scope of practice. There's always a chance that we could see a bill drop about adding dental therapy or mid-level providers. There's lots of things that could be out there. There's other things that we are looking at and considering that we're having discussions about is closing a loophole that's kind of been opened in who can and cannot own a dental practice in the state of Kentucky. Another one is we're starting the discussion of of insurance transparency, dental insurance transparency. I don't know how many of you have heard the term medical loss ratio or dental loss ratio, but this is about the percentage of money that an insurance company collects that goes directly to patient care. And this is kind of one of the hot topics nationally right now. We have a lot of large insurers in this state that you kind of wonder with the number of people that they're insuring and the fact that they still only pay out a maximum of $1,000 a year and only about 2% use that full thousand, how much of the money they're collecting is actually going to patient care. And that's what this is about. And it's not about throwing them under the bus, but it's about making sure that the funds that are being collected are being utilized for what they're being told they're being utilized for. If you ran a company in Kentucky and you were buying a dental insurance plan, you would want to know that most of the money you were paying went for the care of your employees, not for paying the CEO of the company. So this is a big thing nationally. I don't think we're going to do anything about pushing a bill this session with everything else that we've got on the table. But a lot of this is just being aware and being ready to respond to anything that becomes available or comes up. I will move in now to some of the handouts that are on your sheet. So you've got 4 different sections of handouts. There's one of them is Medicaid. I think that's number 3 is the group, right? Is the Medicaid group on your handouts. But there's Medicaid talking points. That's for you. There's carve out talking points. That's for you. There's a 4-color 2-sided handout. That is to print off and leave with the legislator. This is the information to leave with the legislator. So you definitely want to make sure that you review that so you know what's on there. You'll see there's a little blurb that compares some of our reimbursement rates with some of the surrounding states. We have all that information. We're still working off of 2023 numbers because it's very difficult to get all that information from all these different companies. But you'll see that even that we're well behind the people around us, especially Ohio, Indiana, Missouri, Tennessee, even though Tennessee doesn't make their numbers public. There's the carve out sheet, like I said, that'll give you some information about what we mean by carve out. It literally means that we're hoping to remove the dental program from the MCOs and operate it outside of that, which could happen in a lot of different kind of scenarios that have to be worked out by the legislators. But that 4-color sheet is the one that's for your legislator. And then there's one of them is some of the fluoride information that we've put together. Most of this is from the material that's promoted by the American Dental Association. So there are some handouts there from the ADA. Almost all of the fluoride material you can pretty much share with whoever you want. This is public information from the ADA. There's some different handouts that are in there, different information. Uh, there's also the sheet that goes over a lot of the information Libby covered earlier about setting up your meeting, sending your email, making the phone call, the process, all that stuff. It's in writing there, so you've got something to refer back to. And then, here, just kind of a wrap up. We're hoping that you can get a meeting scheduled with your legislator before November 15th so you can avoid the Christmas rush, develop that relationship, become one of our key contacts. You're going to be able to educate them. You're going to become their local expert, and then you'll have an opportunity to ask for their support. And always, always report back to us so we're aware you had that meeting, so we can reinforce that and follow up with that legislator. And the one thing we mentioned in passing, the KD PAC. I do want to tell you that. The KDA and the KD PAC, the Political Action Committee, are two completely different entities. Because of the way that everything's set up, we can through the PAC can make donations to different candidates. Those donations are capped. It's not we're not the type of corporation that can donate endless money to people, and we don't have endless money. So we have to be smart about the way we use our money. But I would encourage you to both support the PAC and to support your local legislator at whatever level you feel comfortable. If you want to leave them with a check for their campaign for $100, $250, or if you want to write a maximum donation check, what is that right now, Lib?
Off the top of my head, I don't know, but I was going to say regarding the PAC, our chairman, Dr. Darren Greenwell, if you are interested, Steve can connect you with
Yeah.
Dr. Greenwell.
And
Um,
in one of the upcoming issues of the journal, we'll be sure and get that um, QR code in there also, so you can look at potentially making a donation there. Um,
and just mark your calendars for Legislative Day. But the big takeaway, don't be intimidated by meeting with your legislator. And, you know, I always say the buddy system. If somebody, if you're nervous and there's a colleague in your area, invite them to the meeting with you. The buddy system's great. Or invite them to your office or go to their office and have a group come by and meet with them. But remember, these are citizen legislators and they do this part-time and they have jobs and families at home in your communities, and they also represent the patients you serve. But it's just a great opportunity, and just stay on message through the process and just save the date for Legislative Day. But in this process, please, please, please report to Steve when you're getting a meeting scheduled. It would just really help because when we're, especially when we're in Frankfurt or I'm in there, if I go in to meet with the legislator, I can say, oh, Senator, I saw Dr. Howard. I understand, Dr. Howard came by your office, and those connections mean a lot to tie the issues together. And
all right, we're going to enter our question and answer. So we're going to cut off the recording. And for those of you that see this later, if you have questions, reach out to myself or Libby. Thank you, guys.